I'm a conservative and I think Americans deserve universal health care. If you don't know me, my name's Alex. I've been a conservative my whole life. The main reason why I'm conservative is because I grew up around a family who was conservative and Catholic. When it was time for me to move out and go into the real world and form my own ideas, my conservative ideas still stay the same. In fact, they actually got stronger. But when it comes to healthcare nowadays, that's one issue that I see differently than other conservatives. Growing up, my idea was taxpayers shouldn't have to pay for other people's health insurance. Why should somebody sit at home all day, not work, get their health insurance, get their medical bills paid for by somebody who works all day, by somebody who's a taxpayer? Now, there's still some truth to that, but as I got older and the pressure and anxiety that me and my family faced from medical bills, from insurance companies, really started to take a toll on me. It started to take a toll on my family as well. A family that really worked hard, a family that worked full-time jobs. I began to think really terrible scenarios, right? Imagine you're driving home from work one day. A drunk driver runs a red light, wrecks into you, you're in a terrible situation, all right, terrible condition. Well, now you're going bankrupt trying to get medical care. That wasn't your fault. I can't even imagine what life's like for people who experience that situation, especially when they don't have no money at all. I can't imagine somebody who works every day and is faced with a sudden disease like cancer, just sneaks up on them, now they're going bankrupt. Or they have a child that's born with a disability or a condition. To me, that's not freedom, that's being trapped, and I really feel like that we can make a change to this without turning our country into a socialist country. I also look at the aspiring business owners, people trying to start their business, current small business owners, very important to the economy, very important to the local communities. They're having to deal with this as well. They don't have an employer to help them out with health insurance. They got to put this out of their own pocket. That's just stress that they don't need, especially trying to start a business. They're not trying to worry about all that stuff. And it sucks because it takes away other people's dreams, ideas of wanting to start businesses. If we look at the food we eat, the air we breathe, the water we drink, the utensils we eat with, they all have chemicals, they all have junk in it. So it's really no escaping all these stuff that really could cause medical conditions. Anyway, in high school, I played a lot of sports. Unfortunately though, I was injury prone a lot of the times. One day, while training for my upcoming track and field season, my sophomore year, I was at the track, running, doing sprints, and I felt a pop in my groin. Usually I'm tough with sports injuries. Usually I try to play through them. But with this situation, I just couldn't. I started to develop a lump in my abdomen. I started to get pain in places where men don't like to get pain. I'll leave it at that. But let me just tell you, it was a terrible experience. So I went to the emergency room and got x-rays. Nothing. Went to go see 2 specialists. Nothing. So I also had an MRI, which the insurance actually did not pay for because they didn't think it was necessary. And I also went to physical therapy for a couple weeks. My parents' insurance deductible at the time was pretty high, so even a little thing like an ER visit, going to the doctors, was like a financial punch in the gut. We weren't poor, but we didn't have all this money either. There was also a time when my mother had to get surgery. Already, the doctor said she needed surgery. One Friday afternoon, offices were closed. Friday at 4 o'clock, we get a letter in the mail from our insurance company. A letter, not a phone call, nothing. Just a letter saying that they can't cover the surgery. The amount of stress that it caused us, especially on a Friday afternoon. Offices were closed, so we couldn't call them up. We had to go the whole weekend, stressing, worrying, all right, until Monday morning to call the office. Thankfully, things worked out. It took a while, but the amount of stress, the amount of crap, the amount of bull crap we had to go through for that is just unnecessary and stupid. Just recently, my girlfriend cut her finger while making food the one day, took her to the ER, got her stitched up, everything was good. Then randomly, suddenly, a big bill comes in. Alright, she's in physician assistant school, studying to be a physician assistant, almost $100,000 in debt. That's fine, right? But now you have this crap creeping up on you, and if you don't pay it off because, well, you can't, right? You're a 22-year-old in grad school, you can't pay it off. Well, now it goes to collections, and now your credit score is damaged right from the jump. So when I look back at these times, it just gives me so much anxiety, so much stress that me and my family went through. Every time I think of health insurance now, every time I think of potential medical emergencies, it's just dreadful. It's just terrible to think of. And like I said earlier, I just could not imagine what other families who have no money at all or even have worse conditions than what I mentioned. All right, I can't imagine what they're going through. So I started to become much more open on the idea of universal healthcare or just cheaper healthcare in general. I get jealous of other countries like the UK, Canada, right? If they have a minor condition, they could go to the doctor. Or if they have an emergency, a really serious emergency, they could go to the ER and get whatever needs to get done to make them better. And they don't have to worry about going bankrupt. They don't have to worry about taking out loans to make sure that they're all right and they're not damaged the rest of their life. Unfortunately, you can't do that in America because if you do, well, now you're having to adjust your monthly budget. You're going to have to take out loans. You're going to have to do all this stuff just because you had to get care. And it's not just yourself you have to worry about. It could be your child. It could be your spouse if, of course, they're on your insurance. So what should we do about it? Well, cheap and universal healthcare in America is not impossible already, but with over 300 million people, it's not as easy to just copy a country like the UK or Canada. So I think firstly we need to find ways to make it cheaper while we chip away and eventually make it universal. Now I know you clicked on this video expecting me to be like, the government should pay for everything. Everything in America should be free. All the health insurance should be free. But we have to be realistic here. So just hear me out first. Firstly, what we could do ourselves is start utilizing preventative healthcare. What I mean by that is start exercising, stop smoking, stop drinking the liters of soda, stop eating fast food, okay? Wear a helmet when you're riding a bike, wear a seatbelt when you're in a car, basic stuff like that. I mean, that should be everybody's responsibility no matter where you live, no matter what the situation is with health insurance. I'd also have no problem with the government banning things like cigarettes and other stuff like that if that meant that they're going to start making healthcare cheaper, if they're going to start really helping their citizens out with healthcare. Sorry, I know a lot of people don't like hands-on with the cigarettes and this and that. Sorry though, that's just how I feel when it comes to healthcare. I think healthcare is more important. If the government really needs to sacrifice that stuff, if they want to be greedy and sacrifice that stuff, hey, I'll take it. Because listen, when we have more citizens taking care of themselves, it reduces the need for them to use these healthcare services. Another thing we can look at related to that is actually rewarding people who want to be healthy, who actually take care of themselves. Car insurances do it. They reward good drivers. Why not reward citizens who are eating good, taking care of themselves? It's going to be hard to make healthcare cheaper or universal when you have so many people coming into the hospitals all the time, swamping the hospitals with conditions, diseases that could have been prevented. Now, everyone, including myself, could be guilty of this. Okay, we could be hypocrites. It's easier said than done, but I just think it's important to know. Remember, folks, this is something that we have to be realistic about. It's not something that could just happen overnight. But now, well, I know what you guys want. What could the government do for us, right? That's what we all want to know. What could the government do for us? I think a good idea, the first thing that we could do, I feel like it could be really easy, is implementing healthcare transparency. And what I mean by that is, well, it's like shopping around with healthcare procedures, right? For example, you have to get an MRI on your back. One hospital, you call them up, say, hey, how much for an MRI? $3,000. Whoa, right? You call the hospital 20 minutes away, 20 minutes farther, I should say. How much for an MRI? $1,000. Okay, I'm going there, right? $2,000 I just saved. That's rent, that's groceries, right? That's so much cheaper. Healthcare shopping, transparency, should be on the website. How much for an ER visit? How much for stitches? How much for x-rays? People got to know instead of getting the care they need, feeling that they're comfortable. A month later when they're struggling, times are tough, they get a letter in the mail saying you owe $1,000 by this date. If not, goes to collections and now your credit score is taking a hit. Come on now, that shouldn't be happening to American citizens who work hard. Now, I sound like an old politician when I say this next thing, but I think we should really start focusing on cutting wasteful spending. We actually got to do it. Everyone says that we do it, but we don't actually do it. I mean, we're spending millions and billions of dollars in America on stuff that does not help actual citizens. Studies on shrimp on treadmills, stuff foreign that doesn't even help Americans, that don't even see the results of it. Government offices with 5 people doing the job that only one person can do. It starts to add up. Now imagine if we went through this budget, trimmed the fat, cut through all that stuff, and put that towards the American citizens and helping them with the healthcare. We don't have to raise taxes on the average guy, righty? Just use what we cut from the junk here and put it towards the healthcare. That's not a liberal or conservative thing. I feel like that's just how you run your household. Another problem in America is the middleman. See, when you go to the doctor or the emergency room or the pharmacy, there's so many people in between you and the actual pharmacy or you and the actual care. Insurance companies, pharmacy, benefit managers, billing departments, and even outsourced contractors. Each one of those middlemen, they take a cut, they add more paperwork, and they just jack up the price. It's like ordering a burger, alrighty, and basically having to go to 5 different people before it gets to you. Now, it went through all those people, they've jacked up the price to $40, right, for a $10 burger, and now the burger's cold. If we just cut out some of these middle layers, these unnecessary middle layers, it'd just be so much easier and we'd be able to actually save more money and be less stressful for people. If your doctor just focus on you, if the nurses just focus on you without having to worry about if this guy's approved or not by his insurance, imagine the care we could get. Imagine how simpler things could be. A problem with this than almost anything in America is the lobbying, alright? It's going to be hard to get rid of that stuff when you have pharmacy companies, insurance companies chasing around congressmen all day saying, you know, please don't do this, please don't do that. We know how lobbying works. It's a mess in America. It's going to be hard to do. It's going to be hard to do. Same thing with taxes, right? TurboTax, they're a huge lobbying, right? Why not make taxes free? We can make taxes so easy in America. Lobbying, though, makes it difficult. Next, you hear a lot about this 2-tier healthcare system, righty? There's the free healthcare that everybody gets, and then there's the advanced healthcare, basically like a private school and public school. And this is when it starts to become more like universal healthcare, and I think that could eventually be the end goal for America and helping with the healthcare. If you're struggling, you just need the basics, right? You cut your finger, you break your arm, you're in a car accident, all right, you need an emergency surgery, Universal healthcare will help you without you not having to worry about going into debt, without you having to take out a loan for something that you couldn't control. That was an accident. But if you want something that has more comfort, faster service, better service, more things to actually do, right? If you want that MRI when it wasn't really recommended, ready? Well, then yeah, go for that private insurance. It's like basically flying first class, right? You're still getting the same place, but you're in a better situation, right? This way nobody's left behind. Nobody's having to take out loans. No one's having to have their life ruined outside their medical conditions. But yet we still have people who get to choose, right? People have a choice. Now, before I wrap this video up, I did want to address some concerns because I always like to see both sides of the argument. I'll talk about what I hear from other conservatives, okay? A big thing, like I mentioned earlier, is the laziness. Listen, I get the laziness, right? Why should we have to pay for health insurance of somebody who just decides not to work, just sits at home all day, right? Why should taxpayers have to pay for that? Why does our tax money have to go for that? I get that. Trust me, I do. But here's the thing. We can't build a system based off these worst case scenarios. Most people aren't lazy. That's just reality. Of course, we hear about the bad things all the time, right? That's how media is. That's how life is. We always hear about the bad things, never hear about the good things. But a lot of people are struggling, already, who do work. Medical bills are a big reason why people go bankrupt. Medical bills are a reason why people prevent this care. Related to this is a worry about higher taxes. Yes, higher taxes are going to be a thing. Taxes are going to be bumped up. But think about it this way, all right? You have a job. You're paying your premium every month, right, for your health insurance. Okay, that's basically a tax. We have to cover our deductibles. We have surprise medical bills that pop up, and we already pay taxes with Medicare, Medicaid, and the VA already. Cutting wasteful spending should help with that as well, though. I won't say it balances out, right? Because, yeah, there will be a bit of an increase in taxes, which I'm fine with seeing if that means I don't got to worry about health insurance. I don't have to worry about being in a bankrupt state because I had to get something I couldn't control. I won't say it balances out, but it's not a bad trade-off. Another worry is, of course, the loss of jobs. There will be some loss of jobs, but there'll also be a big increase of job opportunities with the government, right? Because if we start to shift more of that into the government, well, that's more jobs opening up in the government. Another thing too is these health insurance companies will adapt. They'll be all right. They've been screwing over Americans forever. They'll be all right. Of course, it's not the employees, right? Can't blame the employees, but they'll start to adapt, start to pick up more areas, right? Dental insurance, maybe they'll start covering, they'll start working with vision insurance, whatever the case may be. Alrighty, so yeah, it might be a little short-term problem, and I'm not saying that, we got to deal with it. Maybe there's a way to work around, but I do understand the situation. I do understand why people say it's a concern. The last thing I'll probably want to address is the long time waits. I know I hear all the time complaints about the UK and Canada, right? They go for a simple procedure or something, they're waiting forever. They go to the emergency room, they're waiting forever. Well, there's already wait times in America. Not as bad, I'm sure, as Canada or UK. I mean, I really can't even say because I never went there and had to receive medical treatment. But think about it this way, alrighty? Well, first of all, things that could help that is telemedicine and direct primary care. If you don't know what direct primary care is, it's basically you pay like a fixed rate every month to your doctor. Let's say $100 every month, just to your doctor, no insurance or nothing. You could visit that doctor as many times as you want without having to worry about insurance. $100 is just, I don't know, just an estimate. Could be cheaper, could be more. But I think that could help. And then telemedicine, of course, self-explanatory. Call your doctor up, say, hey, can you prescribe this? Hey, I'm feeling like this. Helps you out, righty? It reduces costs, okay? It reduces a bunch of things. That could be so much easier. It could reduce wait times, alrighty? Instead of having to go to the doctors, be in person, and things like that. Another thing is people are already waiting long enough when they don't have the money to go to the doctors and go to the emergency room. They're already holding it off when they have a serious condition. It just ends up getting worse, right? Would you rather wait an extra 30 minutes or wait a month because you don't have the money right now? And yet, at the end of the day, with this universal health care, if people want to still charge, right, $15, $30 as a copay, flat rate, and that means you don't got to worry about anything else, I'm fine with that as well. Maybe it could prevent people swamping the emergency rooms and urgent care is taking advantage of it, going to get seen for the littlest things, right? If it's free, right? I'm not saying for free healthcare, guys. I'm saying for universal healthcare, where everybody gets the basic needs, where nobody has to go into debt, nobody has to go bankrupt because they get a sudden disease they couldn't control. They got hit by a car. Nobody should have to go bankrupt because of that. People should still have the option to choose private healthcare, already, and people gotta be responsible. People gotta have preventative health care. People need to take care of themselves. People still got to pay a little bit of money, right? Can't be absolutely free. Nothing in this world, well, in this country is free. And we just got to be realistic. Sure, free health care is great, but we got to be realistic. All right, I don't see that ever happening. I don't think that's going to be really possible. Universal health care, when we help everybody out, I think we could do that. We're a very expensive country. Cut the spending, cut the useless garbage from all areas, righty? And really help the American people out. I think we could do it. It's going to take a while. You might be thinking like, well, you are preaching for universal health care. You're a conservative, right? There's other things I'm worried about too, right? And I don't think no matter if Kamala Harris was president, I don't think that she fixes it and makes it universal health care. All right, I don't think she does it. Joe Biden didn't do it, right? I think the only person really is going to take younger people or Bernie Sanders, which Bernie Sanders is too much of a nut anyway. That simple issue of universal health care wouldn't be good for our country anyway. But it really starts with the younger generation. That's why me as a conservative, you see, I'm a free thinker. I think to myself. I'm not preaching what Donald Trump's saying, MAGA's saying. I'm a free thinker. I'm a conservative. All right, and I speak for myself. I'm a conservative who really thinks Americans deserve universal health care. Now, through this whole video, me talking, you might be thinking some things are wrong, some things I missed out on. Hey, I'm not saying I'm 100% right. I'm sure you could argue with me and prove me wrong, prove me right, whatever the case may be. I'm fine with that. Comment down below. I would be happy to have a respectful conversation with you guys. I'm not right 100% of the time, but the simple thing is, I think America could do a better job with the healthcare system. I think they should be treating the people right. They should be treating their citizens right. That's why I'm here, making this video. Hopefully you guys can subscribe. Comment down below, guys. Please feel free to leave your thoughts. I'm out, guys. Peace.